Good afternoon, everyone. Thanks so much for your patience. We've had a little bit of technical difficulties. So thank you all for attending this web event for diabeteshealthequity.org. This project is made possible through a partnership between the National Center for Primary Care at Morehouse School of Medicine and the Bristol-Myers Squibb Foundation's Together on Diabetes initiative. I am Sabrina Jackson, and I have the distinct privilege to serve as today's moderator. In honor of June being Men's Health Month, I would like to welcome you to today's 30-minute webinar, or what we like to call a quickenar, entitled Coping with Diabetes, the Experiences of Black Men Receiving Care from a Diabetes Clinic. Our distinguished presenter is Dr. Apothea Namagayo Funa. She received her MPH in Behavior Sciences and Health Education from Emory University and her PhD in Health Promotion and Behavior from the University of Georgia. Since 2003, Dr. Namagayo has worked in the field of diabetes prevention and control and has collaborated with researchers to analyze, publish, and present on diabetes among disparate populations. Dr. Namagayo's research interests are in the promotion of health among disparate populations. So please join me in welcoming Dr. Namagayo.
Thank you for the introduction, Sabrina. I'm happy to be here to be talking to you guys about diabetes in men during Men's Health Month. The title of the presentation is Coping with Diabetes, the Experiences of Black Men Receiving Care from a Diabetes Clinic. As you're all aware, the prevalence of diabetes is 21.9 million and has been growing. Diabetes is a chronic and complex condition, and it will continue to grow if we do not take any action. Approximately 8 million people do not know that they have the disease, and 21 million individuals know that they have the disease. Compared to other groups, Blacks are disproportionately affected by diabetes, as you could see the percentage of 13.2 compared to whites. If you look at this chart, it talks about the age-adjusted percentage of civilians with diagnosed diabetes by race and sex. I want to draw your attention to the top two lines, the one that's green and the one that's black. Those are for the Black population, with the black line being Black women and the green one being Black men. As you can see, Black men have been trailing behind Black women and have now overtaken Black women. When you look at the next slide, it has a similar trend. This one, however, is for age-adjusted death rates for diabetes. And we see the top two lines again, all the way to the top, the dotted one and the non-dotted one. Those are for Blacks, with the dotted one being Black males. You can see again, Black males have slowly been trailing behind Black women and have now overtaken Black women. When you look at hospitalization data, you see that the rates of hospitalization are high among Black men compared to Black women, white men, and white women when it comes to admission for uncontrolled diabetes with complications. We see this trend also with diabetes and short-term complications, and with diabetes and long-term complications as well. Now, we all know that these data, managing diabetes, can be very complex and challenging. However, this data asks us to look at what's going on with Black men, and yet we know that few studies have focused on the experiences of Black men living with diabetes. Understanding the coping strategies that Black men use and their experiences can be helpful in developing interventions specifically for these men. The purpose of the study was to build on this literature to add information so that we could know more about how to work with Black men. The aim of the study was to explore and understand the coping strategies used by Black men with diabetes. I hope that through this presentation you find the information useful for working with Black men who have diabetes and their support systems. Given that the purpose of the study was to explore and understand, we used qualitative research methods. In particular, we conducted in-depth interviews in person with 30 men who were recruited from a diabetes clinic. This was part of a larger study that included looking at the experiences to include barriers, facilitators, etc. But the focus of this presentation is only on the coping strategies that they use to deal with managing the disease. So the interviews were conducted at the clinic and the men were asked questions on how they cope. No clinical data was collected on the men. To be included in the study, the men had to be Black, 45 to 65 years of age, resident in Atlanta for more than a year, and had to have had type 2 diabetes for more than a year. The men with type 1 diabetes were excluded from the study. Those who agreed to participate received a $20 cash incentive. So an inductive approach was used to look at the data. Basically what we did was we looked for themes relevant to the research question, which was on coping, and then we also pulled out demographic information that was relevant for this specific study. The demographic information included duration of diabetes, marital status, insulin use, etc. The findings reported in this presentation are on only 25 of the 30 men. The 5 men that are excluded have similar demographic information as the rest of the 25 men. However, they did not provide detailed information as relates to the research questions of interest. In the next few slides, I'll share the strategies that were reported by the men and some of the quotes that represent those specific strategies. As you can see, this is what the 25 men look like. Most of them were not married, and majority of them were 51 years and older, had health insurance, a family history of diabetes, had another health illness or injury, used insulin to manage diabetes, and had diabetes for more than 5 years. I do want to bring to your attention, when you look at the married, where it says 76% were not married, that included individuals who were single, those who were married previously but were now divorced, widowed, or separated. Also, when you look at the demographics, there's an asterisk near some of them, such as married, family history of diabetes, etc. That represents an individual who said they did not know. For example, they didn't know their family history of diabetes, and that was calculated in the percentage of no. The coping strategies reported were acceptance, taking action to change behavior, support from healthcare professionals, support from family, seeking healthcare information, support from friends. These were the top strategies reported by more than half of the men in the study. Religion and spirituality and not focusing on the disease were also reported as coping strategies. However, they were reported by fewer men. So I'll now go into talking about each strategy individually and then some quotes and then what actions you can take as healthcare providers. So acceptance of diabetes was one of the coping methods men reported, and here they were talking about their reflection on the notion that they do have the disease. For these men, it occurred at different times. It was either upon diagnosis, and for others, it occurred sometime after they had been diagnosed with a disease. Also, this was not related to how long they had had the disease. Again, acceptance also occurred for different reasons. It's part of my family. There's no way around it. I don't want to develop complications, and I want to live. On this slide, you see 2 quotes from the men. I'm going to read out the bolded aspects of the quote. Most of my family got it. It's something that we accepted. You can manage it. Another man said, I put in my mind saying, well, hey, if I want to continue to live and be healthy about it, this is what I got to do. So what can you do as healthcare professionals? One, you can recognize that individuals' acceptance of disease status occurs at different times for different people. The next thing is that you can guide individuals to acceptance using some of the reasons reported, such as wanting to live longer, not wanting to develop any complications. The next coping strategy the men identified was taking action to change behavior. The men talked about this in terms of making small or large changes to engage in healthy behaviors required of diabetes. Now, the men talked of a number of different behaviors related to managing diabetes. However, eating healthy and engaging in physical activity were behaviors most discussed by the men. As the men were discussing this, they also incorporated goal setting to changing the specific behavior. And men wanted to be in control of the disease and not let the disease control them. And here is a quote from one of the men. "I stopped drinking, I don't drink anymore, stopped eating a lot of fried food, don't eat out like I used to, don't drink like I used to, don't do the bad things." So what can you do as health professionals? One, you can ask the men about actions they've taken since the last visit. You can also provide actions for them to take before the next visit. Again, these can be small or they could be large actions depending on the man. You can also help the men with goal setting related to these specific actions and leverage the notion that men want to be in control of the disease and not let diabetes control them. Also, you may want to use positive reinforcement to encourage the men for the small or large action steps they've taken before the visit and to encourage them to take action steps before the next visit. Another coping method strategy that was used by the men was support from healthcare professionals. Now, we know that these men were recruited from a diabetes clinic, so they definitely spoke about the support they received from that diabetes clinic. And this was help with managing the disease, and it constituted help from the healthcare team as primary care provider, nutritionist, podiatrist, etc. that were within that specific clinic. The men also talked about receiving support from outside the diabetes clinic. Again, most of these men had other conditions other than diabetes, so it made sense for them to look for help with managing the other health issues that they had. And this was help from individuals such as pharmacists, case managers, etc. Now here's a quote from one of the men in terms of talking about how healthcare professionals help them. "What you call it, some kind of lectures, and I say, they talk to you, depending on if you're doing okay. They say, 'Oh man, your sugar is down, Mr. X, that's very good.' They encourage you, talk to you, and encourage you." So what can you do as healthcare professionals? You can continue to encourage and support the men. The men love the encouragement. The second thing is you can recognize that these men see other healthcare professionals for their healthcare conditions that are outside of diabetes. So you want to ask these men about their experiences in other healthcare settings because this might give you a better understanding of how they're dealing with diabetes outside of the clinic setting as well. Support from family was another coping strategy that the men highlighted. This was support from grandparents, parents, siblings, wives, etc. And from this support from family, we see that they were learning vicariously through these family members. From the mothers and sisters, this was seen as critical support, or most of the men talked about mothers and sisters. Brothers were also seen as helpful. I do want to bring to your attention that having a family history of diabetes was helpful for the men, especially if they were aware of that family member before they were diagnosed with the disease, because they would watch that family member as they were dealing with the disease. Here are two quotes from the men. "My mother had taught me very much about it. I know what it's like when I got it and how it affects me because of the way it affected her. I watched my brother. I seen how he had to deal with his. I don't want to be sticking myself and pricking myself, so I said, let me just do it and get this under control." So what can you do? Ask the men about how family members have been helpful in their management of diabetes. Additionally, you can provide the men with steps on how to include family in the management of their diabetes. You can ask them to ask about family members with a family history, and if they can get any tips from those specific family members. Another coping strategy reported by the men was seeking healthcare information related to diabetes. Now, all these men were recruited from a clinic and had access to diabetes self-management education, which was in the specific clinic. They also sought other sources of information other than the diabetes self-management education, and this was like from print material, television, etc. Here is a quote from one of the men. I advise anybody to go to your class. You learn yourself, you learn what your diabetes is doing to yourself, you learn what you can and can't do with food, what type of food, you learn to eat what you know you can get by without raising your sugar level. So what can you do as healthcare professionals? Provide access to DSME. If you do not have access to diabetes self-management education within your clinic, refer the men to the programs that are available close to the clinic or closer to where the individuals live. Ask the men about the type of information they're looking for. You never know. The information might be within the clinic, or the clinic might decide that maybe we should include this type of resources for the men. Another coping strategy reported by the men was support from friends. This included both male and female friends, with the female friends helping them by encouraging them, helping the men with monitoring. This was also seen from the men as well, but I did want to highlight that the male friends were providing support in a vicarious way, in that their friends had diabetes, and so by seeing their friends' experiences, the men would say to themselves that they didn't want to have to experience what their friends were experiencing. Here is a quote from one of the men about how his friends, both male and female, have been helping. They look at me, right? And now what they start doing, they start thinking of healthier ways of eating, so they start suggesting Subway, like I said. So that's how they help me out. So what can you do as healthcare professionals? You can ask the men about how friends have been helpful in the management of their diabetes. You can ask the men if any of their friends have diabetes. Additionally, you can provide the men with steps on how they can include friends in the management of their diabetes. Now, I've shared with you a few strategies on how the men have been coping with diabetes outside of the clinic. These strategies are similar to that reported in the literature, and the men talked more about problem-solved coping, where they took action or they set goals, versus emotion-based coping. They also had positive coping strategies, which is different than negative coping strategies, in that they didn't report the use of alcohol to cope or smoking to cope. And this, again, the positive coping aligns with recommendations by diabetes educators. The information I've shared, I hope, is useful for you as you're working with the men with diabetes. I know that in the clinical setting, there's a limited amount of time that you have with the patients. So take one coping strategy, apply that, get into the lives of these men and talk to them about what's going on with them outside of the clinic. This will help them tremendously in managing their diabetes. I did want to share a few limitations about this data and how you could interpret it. For one, the data is self-report and is not generalizable to all Black men in the US or in Georgia. The data was collected from a specific clinic within Georgia and on 25 men. I also want to share that interview and participant bias may have shaped the findings I have shared with you. For example, the men may have thought I worked at the clinic and possibly provided me with desirable responses related to the research questions. And then duration of diabetes impacts experience and how the men reported about their experience. and personal events before they came for the interview may have impacted reporting of their experience. I want to acknowledge the Black men who participated in this study and the professors from University of Georgia who I worked with on this study, plus the staff from the diabetes clinic. Thank you, and I'm looking forward to your questions, and I have my contact information in case you don't get to ask a question during this question and answer session.
We're gonna freeze that question and then freeze the camera and then I have a question. I just don't want to be on camera. So. All right, thank you so much for sharing with us today, sharing your research. You may have already answered my question, I would think, and I also am a medical provider, and some of these results were surprising to me, but it brings to light when we look at disparities, and our goal here with diabeteshealthequity.org is to help the diabetes community at large to find strategic ways to decrease disparities. Some of that is examining our attitudes and forcing ourselves to change and to evaluate how we do what we do. And we know when dealing with minority population, with disparate populations, we all assume lots of things. We probably assume lots of things with any population. But you know, in viewing men and their health, you always think that men don't care, you know, that men are reluctant to take care of themselves, to go to the doctor, that kind of thing. So some of the questions, the answers were surprising to me, the comments, but you framed it in that these were self-reported. We're not really sure what their motivations were, but just in reporting what you did, it does helps to encourage me to be more mindful that when I do approach a patient, that he is an individual. And it's quite possible that he's not a typical man, in quotes, in the way he views his health and his health care and the things that he's willing to do to get better outcomes or to get better results. So I said all of that to say thank you for sharing that. It definitely challenged me in my thinking and the way I view my patients. I'm not sure if we have any questions or if there are any coming in, if people are formulating.
Well, while someone is typing, I did want to share this is just from a methodological perspective. When I was recruiting the men, once I got to interviewing the men and I told them what the study was about and that I wanted to know about their experiences, the men said, "Oh, it would only take 5 minutes and I'll be able to tell you what's going on with my diabetes." However, as we started to talk, the conversation got longer, and the men felt at the end that they were glad that somebody stopped to listen to them. So listening is also one thing that you can do. Sometimes the men may brush it off initially, but once they get started, it's they just kind of share, and it's a good feeling when everybody just stops for a moment to share what's going on with themselves.
I had a conversation a week or so ago with a family member who's a male with diabetes, and I asked him, just in filling him out about his experience with his healthcare system and how he was managing his diabetes. And one of the things that he consistently said was he was motivated to care for himself better because of the kind of care that he received. He felt like his medical team cared about him. He felt like they listened to him. He had access to them. And quite honestly, I was shocked that those kinds of things would matter to a man. I would just assume that for women it would matter, for men it would be a bother. But we probably talked a half hour, and he stated more than once that he felt as if they cared, and he appreciated that they listened. He felt like an individual, but he felt important, like his care and what happened to him mattered to them, and that was a motivation for him to follow their recommendations, to be more engaged in his medical care, and definitely to keep his appointments, to participate in what they provided for him. So to that vein, it does matter.
It does matter
to men,
to
and
listen.
We can't assume that it doesn't. I would like to say that to our audience that we'd like for you to complete a survey. just to give us some feedback on what you thought about today's webinar, but also you'll have the opportunity to suggest topics that you'd like to hear in the future. The link is in the chat box as we speak, so feel free to click on it. And I would also like to just thank you again for attending. I want to invite you to go to our website. That's diabeteshealthequity.org. Somebody is talking to me, and the older I get, the harder it is for me to do more than one thing at the same time. Please register for future upcoming web events. So click on the following link, and that's what I was about to say, to go to our website. If you go to the events page, because we'd love for you to see our site, go to the events page, and it's on the landing page where you'll see a list, a calendar of the events that we have. July will be focusing on community benefit. So it's a new buzzword in a sense, gaining a lot of popularity as of late. We're going to be having a webinar as well as rolling out what we call coffee shop chat. So it'll be an informal conversation where you guys will be able to have more interaction with the speaker who are real world experts on the topic. We'd also like for you to go on and read a best practice story, to download, visit our resource page to download tools and templates, post a comment on the forum or propose a topic for the forum. Download a tool or template, we said that. And then if you have any questions, comments, know of a best practice story or diabetes health equity champion, these could be patients, these could be providers, community health workers, health coaches, just people that you know in the space of diabetes care who you feel like are doing a great job at what they do. We'd love to have those suggestions and a way to connect with them. The good thing about diabeteshealthequity.org is it's an emerging community, and we want to create an environment where we interact with each other so we can have more informal conversations. We can have them around topics, we can have them around specialties, around parts of the country where you live. This is your community. We want you to be engaged and to feel free to take ownership and to participate as much as you'd like. You can also like us on Facebook and tweet us at P4DHE, that's FORDHE, and use the hashtag PDHE. So again, this project is made possible through a partnership between the National Center for Primary Care at Morehouse School of Medicine and the Bristol-Myers Squibb Foundation Together on Diabetes Initiative. Thank you again, audience, for participating, and thank you, Dr. Namageo, for sharing your research with us. Have a great afternoon.